Hi, I'm Stephen Feldman, a licensed mental health counselor with Insight Room Psychology, where we understand the mind one insight at a time. Welcome back to my three-part series on gender-affirming mental health treatment. In part one, we talked about gender dysphoria itself. In part two, we talked about the mental health evaluation process. And in this third and final part, we're going to talk about the gender-affirming treatment itself, including recovery, psychological assessment, relationships, body image, sexuality, the surgeries, and longer-term mental health and quality of life concerns. My goal is to give you a realistic understanding of the process, including both the positive changes many people experience, as well as some of the challenges that can come along with them. So let's get started.
Gender-affirming medical care can involve a number of different pathways, and there is no single experience that applies to everyone. For some people, treatment may involve hormone therapy. For others, it may include one or more surgical procedures, and some people may pursue both or neither. Beyond the physical changes themselves, these experiences can also involve significant psychological, emotional, and social adjustment. We'll begin by looking at hormone therapy, including some of the physical and emotional changes that may occur over time. Before we go any further, I want to be clear about what this video is and what it is not. This is an educational overview of gender-affirming care, including medical, surgical, and mental health considerations, with the goal of providing accurate and respectful information that can support greater understanding and informed decision-making. It is not intended as political advocacy or debate, and is not meant to tell everyone what decisions they should make about their own care. It is also not a one-size-fits-all guide. Gender-affirming care is highly individualized, and people can have very different goals, needs, experiences, and outcomes. The information presented here should not be replaced for individualized medical or mental health care from qualified professionals, and we won't be able to cover every possible procedure, treatment option, or individual circumstance. Instead, my goal is to provide a clinically informed overview that can help gender diverse individuals, their loved ones, and professionals better understand some of those experiences that may occur throughout this process. As we go through these topics, I encourage approaching them with curiosity, compassion, and respect for the fact that each person's experience is their own. Before we move into specific topics, there are a few important disclaimers to keep in mind. This video is intended for adults age 18 and older because some of the material involves gender-affirming medical procedures, anatomy, sexuality, and other topics that may not be appropriate for young viewers. Everything presented here is for educational and informational purposes and should not be considered a substitute for individualized medical or mental health advice, diagnosis, or treatment. Later in the video, you may also see simplified medical and anatomical illustrations. These graphics are not nudity, they are educational illustrations included to help explain anatomy, surgical procedures, and physical changes more clearly. Some of the topics we discuss may also feel sensitive, personal, or emotionally challenging for some viewers, so please use your own discretion while watching. You are always welcome to pause, take a break, skip a section, or stop watching if you become uncomfortable. With those considerations in mind, we can begin by taking a closer look at gender-affirming hormone therapy. Hormone therapy can be an important part of gender-affirming care for many people, but its effects extend beyond physical changes alone. As the body begins to change, people may also experience shifts in mood, emotional expression, self-perception, confidence, and their overall relationship with their body. Some changes may feel affirming or relieving, while others can require time to become familiar with, and the pace and degree of change can vary considerably from one person to another. Hormone therapy is also a gradual process, which means expectations about what will change, when it will happen, and how it will feel can have significant impact on psychological adjustment. In this section, we'll look at some of the common physical changes associated with hormone therapy, the general timelines in which those changes may occur, and the emotional adjustment that can accompany a body that is gradually becoming more aligned with a person's gender identity. Let's start with feminizing hormone therapy and estrogen. Estrogen is generally the primary hormone used to promote the development of typically feminine secondary sex characteristics, and there are several ways it can be administered. Oral estradiol is taken by mouth, while sublingual estradiol is allowed to dissolve under the tongue. Estradiol can also be delivered through the skin using patches or gels, or it can be given by injection, commonly using forms such as estradiol valerate or estradiol cypionate. These different routes aren't simply interchangeable in every situation. They can differ in dosing schedules, how hormone levels fluctuate over time, convenience, cost, medication availability, and certain medical risk considerations. There isn't one form of estrogen that is automatically the best choice for everyone, and the appropriate medication, route, and dose should be individualized with a qualified medical provider based on a person's goals, health history, laboratory monitoring, response to treatment, and potential risk factors. It's also important to remember that more estrogen does not necessarily mean faster or better feminization. The goal is typically to find an appropriate and medically monitored regimen that supports desired changes while minimizing unnecessary risk. The second major component of some feminizing hormone regimens involve medications that reduce the production or effects of androgens such as testosterone. One commonly used option in the United States is spironolactone, which has a diuretic properties, but also blocks androgen receptors and can reduce testosterone activity. Another option is a class of medications called GnRH agonists, including medications such as leuprolide, histrelin, and goserelin, which suppress hormonal signals to the gonads and can substantially reduce testosterone production. Serpinterone acetate is another anti-androgen used in a number of countries, although it is not FDA approved in the United States. Mycophenolate works differently by blocking androgen receptors rather than directly lowering testosterone levels, and it is sometimes used off-label, although it requires appropriate medical monitoring because of the potential liver effects. Not everyone receiving feminizing hormone therapy will need an androgen-lowering medication, and these medications have different benefits, limitations, side effects, monitoring requirements, and availability. The specific approach should be therefore individualized by a qualified medical provider based on a person's health history, treatment goals, laboratory findings, response to treatment, and individual risk factors. The final medication we'll discuss as part of feminizing hormone therapy is progesterone. Unlike estrogen, progesterone is not considered a necessary component of feminizing hormone therapy, but micronized progesterone is sometimes added to an individual's regimen. Some people report benefits related to breast development, mood, sleep, or body composition, but the scientific evidence supporting these effects remains limited and continues to evolve. There is also not yet a clear consensus about who is most likely to benefit from progesterone, when it should be introduced, or how much additional feminization it provides beyond estrogen and androgen suppression. This is an important example of why individual experiences with hormone therapy don't always perfectly match what has been established through clinical research. A person may experience a change that feels meaningful to them, even when the broader evidence is still developing. For that reason, progesterone should be considered on an individualized basis with a qualified medical provider who can discuss the potential benefits, limitation risks, and uncertainties involved. Not everyone receiving feminizing hormone therapy takes progesterone, and choosing not to use it does not mean that a person's hormone regimen is incomplete. Now, let's look at masculinizing hormone therapy, where testosterone is the primary hormone used to promote the development of and maintenance of typically masculine secondary sex characteristics. Testosterone is available in several formulations. Common injectable options include testosterone cypionate and testosterone enanthanate, which are typically administered on a regular dosing schedule determined by the prescribing provider. Testosterone undecanate is a longer acting injectable formulation that can allow for less frequent dosing. Transdermal testosterone gel is applied to the skin, usually daily, and can provide relatively steady hormone exposure without injections. Testosterone patches and other formulations may also be available, uh, although their use and availability can vary by location and individual circumstances. Over time, testosterone can contribute to changes such as a deeper voice, increased facial and body hair, increased muscle mass and strength, changes in fat distribution, cessation of menstruation for many people, and changes in sexual functioning and libido. As with feminizing hormone therapy, the type, dose, and route of testosterone should be individualized based on treatment goals, medical history, laboratory findings, response to treatment, potential risks, and personal preferences. These changes also occur gradually, and the timing and degree of masculinization can vary considerably from person to person. In addition to estrogen, testosterone, and androgen-lowering medications, there are several other medications that may be used alongside gender-affirming hormone therapy to address specific needs. GnRH agonists, for example, suppress signals that stimulate the gonads to produce sex hormones and may be used for puberty suppression in adolescents or in certain circumstances with adults. Medications such as finasteride and dutasteride reduce the conversion of testosterone into dihydrotestosterone, or DHT, and may be considered when addressing concerns such as androgen-related hair loss or when reducing certain androgenic effects as desired. Progestins, such as norethindrone acetate, may be used to reduce or stop menstrual bleeding, while injectable dipomedroprogesterone acetate, sometimes called DMPA, can also be used for menstrual suppression. Other options may be considered depending on the individual circumstances. The important point is that gender-affirming hormone therapy isn't necessarily a single standardized medication regimen. The medications someone uses can depend on their anatomy, age, treatment, goals, health, history, response to treatment, and which physical changes they do or do not want. Some people may benefit from additional medications while others may not need them at all. So these decisions are best made collaboratively with a qualified medical provider. Next, we're going to shift from hormone therapy to gender-affirming surgery. One of the most important things to understand from the beginning is that surgery is a deeply individual decision, and it is not something that every transgender or gender-diverse person wants or needs. There is also no particular procedure that someone has to pursue in order for their gender identity to be valid. For someone who is considering surgery, the decision involves much more than simply asking whether a particular procedure is available. It can involve thinking carefully about your personal goals, what changes you hope surgery may provide, your expectations for the outcome, your physical and mental well-being, medical considerations, your support system, and practical issues such as finances, time away from work, transportation, and recovery. It can also be helpful to consider whether this feels like the right time for you, because knowing that you want a procedure and being ready to undergo it are not always the same thing. The goal is not to arrive at a particular answer. The goal is to make an informed decision that reflects your own values, needs, circumstances, and vision for your life. A useful place to begin when considering surgery is asking yourself what you are actually hoping surgery will change. This can include identifying specific aspects of your body that contribute to gender dysphoria, distress, or a sense of incongruence, as well as the physical changes you hope a particular procedure might provide. It's equally important to examine your expectations and determine whether they are consistent with what the procedure will realistically accomplish. Surgery may significantly reduce dysphoria and improve quality of life for some people, but it cannot necessarily resolve everyday difficulty related to body image, relationships, self-esteem, or mental health. It is also important to remember that surgery is an individual choice, not a requirement for being transgender or gender diverse. Some people pursue multiple procedures, some choose one particular procedure, and others don't want surgery at all. None of these pathways is inherently more valid than another. Looking beyond the immediate decision can also be helpful. Consider how surgery fits with your identity, your personal values, your anticipated future, and your longer term goals. There is no single right transition pathway. The goal is to make an informed decision about what is right for you. Making an informed decision about surgery means understanding both the outcomes you hope to achieve and the potential risks, limitations, and trade offs involved. For many people, gender affirming surgery can reduce dysphoria, increase comfort with their body, and create a greater sense of physical congruence. At the same time, these are still surgical procedures, and risks can include infection, bleeding, scarring, changes in sensation, difficulty with healing, and other complications that vary depending on the specific procedure. Many surgical changes are also permanent or difficult to reverse, which makes understanding the expected outcome particularly important. Some procedures can affect fertility, reproductive anatomy, sexual functioning, or sensation, so fertility preservation and future reproductive goals may be important to discuss before surgery when applicable. It's also possible that someone may eventually want or need an additional procedure or surgical revision, and depending on a person's goals, non-surgical approaches or a different procedure may sometimes be reasonable alternatives to consider. Informed consent is therefore much more than signing a form. It means having enough information to understand the potential benefits, risks, alternatives, limitations, and uncertainties, asking questions when something isn't clear, and ultimately making a decision that you feel adequately informed and prepared to make. The final part of deciding whether surgery is right for you involves thinking beyond the procedure itself and considering whether you're prepared for the recovery that follows. Physical health is one part of that preparation. Existing medical conditions, medications, nutrition, nicotine use, and other health factors can affect surgical planning, healing, and complication risk. So it's important to discuss these openly with your surgical team. Mental and emotional preparation matters as well. Recovery can involve pain, fatigue, temporary limitations, uncertainty, changes in appearance, and periods of increased dependence on other people. So it can be helpful to consider how you typically cope with stress, discomfort, uncertainty, and major life changes. Your support system can also make a significant difference. Think about who can provide transportation, help with meals or daily activities, attend to practical needs, or simply offer emotional support when recovery becomes difficult. There are also logistical and financial considerations, including time away from work or school, travel, lodging, follow-up appointments, insurance coverage, deductibles, medical supplies, and potentially lost income. Finally, aftercare can require a substantial commitment, including wound care, medications, activity restrictions, follow-up appointments, and other procedure-specific instructions. So the question isn't only, do I want surgery? It's also, do I understand what this procedure involves, and am I adequately prepared for the recovery that comes afterward? Now that we've discussed some of the factors involved in deciding whether surgery is right for you, let's look at the major types of gender-affirming surgical procedures. This can include chest or breast surgery to masculinize or feminize the chest, facial procedures that alter particular facial features, and reproductive organ surgery such as hysterectomy, oophorectomy, or orchiectomy. Genital procedures can include vaginoplasty or vulvoplasty, as well as masculinizing procedures such as metoidoplasty and phalloplasty. Other gender-affirming procedures may address areas such as the voice, body contouring, or hair removal. It's important to understand that these aren't steps on a checklist, and there is no expectation that someone will pursue all or even any of these procedures. Some people choose a single surgery while others pursue multiple procedures over time, and certain surgeries themselves may involve multiple stages. Each option also comes with its own goals, potential benefits, risks, recovery process, and long-term considerations. In the next several slides, we'll look more closely at some of these procedures so you can better understand what they involve and how they differ from one another. Let's begin with chest and breast surgery, which can involve either masculinizing or feminizing procedures depending on a person's goals. Chest masculinization surgery, often referred to as top surgery, generally involves removing breast tissue and reshaping the chest to create a more masculine contour. Depending on the surgical technique, the nipples and areolas may also be resized, repositioned, or reconstructed to better fit the desired chest appearance. For people seeking a more feminine chest contour, breast augmentation can increase breast volume and alter shape, most commonly through implants, although fat transfer may also be an option in selected cases. One important point is that there isn't a single technique used for everyone. Surgical planning can depend on factors such as existing anatomy, the amount of breast tissue, skin elasticity, nipple and areola characteristics, previous hormone-related breast development, desired appearance, and the recommendations of the surgical team. Different techniques can also involve different incision patterns, scarring, changes in nipple sensation, recovery considerations, and potential need for revision. Discussing these differences with an experienced surgeon can help someone understand which outcomes are appropriate for their anatomy and which approach is most likely to align with their individual goals. Facial gender-affirming surgery can involve a number of different procedures designed to alter facial features in ways that feel more congruent with a person's gender. For some people, facial characteristics can be a significant source of gender dysphoria because the face is highly visible and plays an important role in how we recognize ourselves and how others perceive us. Procedures involving the forehead and brow can change forehead contour, brow prominence, or the position of the hairline. Rhinoplasty can modify the size, shape, or proportions of the nose, while procedures involving the jaw and chin can reshape, narrow, enhance, or soften the lower face. Changes to the cheeks and other soft tissues may involve techniques such as implants or fat grafting to modify facial contours. A tracheal shave, also called chondrolarynoplasty, can reduce the prominence of the thyroid cartilage, commonly referred to as the Adam's apple. These procedures can be used to create either more feminine or more masculine facial characteristics depending on someone's goals, although not every person wants or needs the same changes. Facial gender affirming surgery is therefore highly individualized and may involve one procedure or a combination of several procedures based on anatomy, personal goals, and recommendations from the surgical team. Another category of gender affirming surgery involves the reproductive organs, and these procedures may be performed independently or as part of a broader surgical plan. A hysterectomy involves removal of the uterus, while an oophorectomy involves removal of one or both ovaries, and a salpingectomy involves removal of one or both fallopian tubes. An orchiectomy involves removal of the testicles, which substantially reduces the body's production of testosterone and may also change someone's ongoing hormone medication needs. These procedures can serve different purposes depending on the individual, including reducing gender dysphoria, addressing specific health concerns, eliminating menstruation, reducing endogenous sex hormone production, or preparing for other gender-affirming procedures. An especially important consideration is fertility. Depending on which reproductive organs are removed, some of these surgeries can permanently affect or eliminate a person's ability to have genetically related children using their own eggs or sperm. For someone who may want biological children in the future, fertility preservation options such as egg or sperm cryopreservation may be worth discussing before surgery. These decisions can be emotionally complex, particularly when someone's current feelings about parenthood may differ from what they imagine wanting years from now. The goal isn't to assume that everyone should preserve fertility, but to make sure that the decision is considered before an irreversible procedure when it is relevant to the person's goals. Vaginoplasty and vulvoplasty are two related but distinct gender-affirming procedures, and understanding the differences between them is important when considering surgical goals. Vaginoplasty creates an external vulvar structure as well as a vaginal canal, using available genital tissue depending on the surgical technique and individual anatomy, potentially tissue from other areas of the body. Vulvoplasty, sometimes referred to as a zero depth or shallow depth vaginoplasty, creates external vulvar structures without creating a full depth vaginal canal. Both procedures may help improve gender congruence and address dysphoria related to genital anatomy, but they result in different anatomy and have different implications for sexual functioning and long-term aftercare. For someone who wants the possibility of receptive vaginal penetration, creation of a vaginal canal may be an important goal. With many forms of full-depth vaginoplasty, however, maintaining that canal requires a significant commitment to post-operative vaginal dilation, particularly during the earlier stages of recovery, with the schedule generally decreasing over time according to the surgical team's recommendations. Vulvoplasty typically does not require the same ongoing dilation regimen because a full-depth canal is not created. The choice between these procedures is highly individualized and can depend on anatomy, health considerations, sexual goals, desired function, personal preferences, and willingness or ability to complete the necessary postoperative care. Metoidoplasty is one option for masculinizing genital surgery and uses clitoral tissue that has typically enlarged in response to testosterone to create a small phallus. During the procedure, surrounding tissues and ligaments can be released so that more of the existing erectile tissue is exposed, which can increase the visible length of the phallus. One of the distinguishing features of metoidoplasty is that it preserves native erectile tissue and typically maintains a high degree of erogenous sensation, with the ability to become naturally erect without an erectile implant. Depending on the person's goals, urethral lengthening may also be performed so that urination while standing may be possible, although this adds additional surgical considerations and potential complications. Scrotoplasty can be performed to create a scrotum, and testicular implants may be added either during the same surgical process or at another stage. Other procedures such as hysterectomy, vaginectomy, or vaginal closure may also be incorporated depending on the individual's surgical plan. Compared with phalloplasty, metoidoplasty generally results in a smaller phallus, so the two procedures offer different potential outcomes in terms of size, appearance, sexual functioning, urination, surgical complexity, and recovery. There isn't one option that is universally better. The appropriate choice depends on anatomy, priorities, desired function, tolerance for surgical risk and recovery, and what outcomes matter the most to the individual. Phalloplasty is another option for masculinizing genital surgery and involves constructing a phallus using tissue taken from another area of the body. Depending on the surgical technique and individual anatomy, donor tissue may come from areas such as the forearm or thigh. Unlike metoidoplasty, which uses existing testosterone and large clitoral tissue, phalloplasty allows for the construction of a larger phallus, but it also a considerably more complex surgical process. Urethral lengthening may be performed so that urination through the constructed phallus, including potentially while standing, is possible. Scrotoplasty can also be performed to create scrotum, with testicular implants added depending on the person's goals and surgical plan. Because the constructed phallus does not naturally become rigid in the same way as native erectile tissue, an erectile implant may be placed during a later surgical stage if penetrative sexual function is desired. An especially important point to understand is that phalloplasty is typically not a single operation. It commonly involves multiple surgical stages with substantial healing time between them, and additional procedures or revisions may sometimes be necessary. Outcomes can vary considerably based on the surgical technique, donor site, anatomy, healing complications, and individual goals. Because of its complexity, choosing an experienced surgical team, understanding the potential risks and trade-offs, and being prepared for comprehensive postoperative care are particularly important considerations when evaluating phalloplasty. Beyond the major procedures we've already discussed, there are a number of other gender-affirming interventions that may help someone feel more comfortable and congruent with their body or self-expression. Voice-related care is one example. Voice therapy can help someone modify characteristics such as pitch, resonance, speech patterns, and vocal expression, either on its own or in combination with voice surgery. Body contouring procedures can also change body shape with proportions through approaches such as liposuction, fat grafting, or implants, depending on the person's anatomy and goals. Hair removal through laser treatment or electrolysis may reduce unwanted facial or body hair and can also be medically necessary as preparation for certain genital surgeries when hair-bearing tissues will be used in reconstruction. Other options can include hair restoration, neck procedures, and additional aesthetic or reconstructive procedures depending on someone's individual needs. What's important throughout this discussion is that gender affirmation is highly individualized. There isn't a specific number or combination of procedures that someone needs in order to complete a transition. Some people pursue several procedures, some pursue only one or two, and some don't pursue surgery at all. The goal is not to follow a predetermined pathway, but to identify which interventions, if any, meaningfully support your own sense of congruence, functioning, and overall well-being. As we finish this overview of surgical options, it's important to emphasize that there is no single sequence of procedures that defines gender-affirming care. Someone may decide that chest surgery is the only procedure they want. Another person might use hormone therapy and later pursue chest surgery, facial procedure, or voice-related care. Someone else may pursue reproductive surgery followed by genital reconstruction, while another person may choose several smaller procedures spread across a number of years. One procedure, several procedures, or no surgery at all can each be valid choices. Some surgeries also occur in stages because the body needs time to heal between procedures, because certain types of reconstruction inherently require multiple operations, or because later decisions depend on the outcome of an earlier procedure. Timing can also be affected by health, finances, insurance requirements, access to surgeons, work or family responsibilities, and a person's readiness for another recovery. And importantly, goals themselves can change over time. A procedure that doesn't feel important to you today may become meaningful later, or something you once expected to pursue may no longer feel necessary. Gender affirming care doesn't need to follow a predetermined timeline or end at a particular destination. Your goals, circumstances, and sense of well being can guide what happens next, and there's no single endpoint that defines a successful transition. Now that we've covered the major surgical options, I want to shift attention from the procedures themselves to psychological preparation. Preparing for gender affirming surgery involves more than understanding what will happen medically. It also means preparing for emotional experience of surgery and recovery. One useful starting point is reconnecting with your reasons for pursuing the procedure and what you hope it will mean for you, while also maintaining realistic expectations about the outcome and recovery process. It's helpful to strengthen coping strategies for managing stress, pain, uncertainty, frustration, and unexpected setbacks before you actually need those skills. Planning your support system is equally important, including identifying people who can provide practical assistance as well as emotional support. Recovery may temporarily reduce your independence, and needing help during that period is a normal part of recovery from a significant medical procedure. It can also take time for swelling to decrease, scars to heal, sensations to change, and the final surgical result to become apparent. So patience and self-compassion can become particularly important. And perhaps most importantly, surgery is a milestone rather than a psychological finish line. It may provide profound relief or greater congruence, but your emotional well-being, relationships, identity development, and adjustment to your changing body continue after the procedure. In the next few slides, we'll look more closely at how to prepare for that experience. One of the most useful parts of psychological preparation is becoming clear about your own why. This doesn't mean that you need to feel 100% certain or never experience anxiety or doubt. Instead, it means understanding the values, needs, and goals that are informing your decision. Start by asking yourself what specifically you hope surgery will change. Is there a particular source of dysphoria, physical discomfort, or incongruence that you want the procedure to address? Then consider what matters to you most about the outcome. That might involve appearance, physical function, comfort in your body, intimacy, sexuality, identity, or simply being able to move through everyday life while thinking less about a particular part of your body. It's also worth asking whose decision this really is. Try to distinguish your own goals from expectations you may feel from partners, family, healthcare providers, other transgender people, social media, or broader ideas about what transition is supposed to look like. Another useful question is, why now? You may have wanted surgery for years, but understanding why this particular point in your life feels appropriate can help clarify your readiness. Finally, think about what a good outcome would actually mean to you. Success doesn't have to mean achieving a perfect body or eliminating every difficult feeling. It may mean less dysphoria, greater comfort, improved functioning, or simply feeling more at home in your body. A clear why isn't about achieving absolute certainty. It's about understanding what matters to you and allowing those values and goals to guide your decision. Another important part of psychological preparation is making room for the difference between expectations and reality. You might understandably imagine that you'll feel better immediately after surgery, but the early recovery period can include pain, fatigue, swelling, limited mobility, dependence on other people, and emotional ups and downs. You may have a very specific picture of what you expect your body to look like afterwards, but surgical outcomes and healing vary between individuals, and what you see during the first days or weeks of recovery is not the final result. It's also reasonable to hope that surgery will significantly reduce gender dysphoria, and for many people it does. But that doesn't necessarily mean every experience of dysphoria will disappear. Similarly, surgery can improve gender-related distress without automatically resolving unrelated anxiety, depression, trauma, relationship difficulties, body image concerns, or other mental health challenges. And there isn't one emotionally correct way to feel after surgery. You may experience happiness and relief while also feeling anxious, vulnerable, frustrated, overwhelmed, or temporarily uncertain. Those emotions can coexist without meaning that you've made the wrong decision. Realistic expectations aren't pessimistic, and they don't diminish the potential benefits of surgery. They help prepare you for the full range of experiences that can occur during recovery so that temporary difficulties are less likely to be interpreted as evidence that something has gone wrong. Another useful part of preparing for surgery is building a coping toolkit before beginning recovery. The goal isn't to eliminate stress or difficult emotions, but to have strategies available when you're tired, uncomfortable, uncertain, or overwhelmed. Stress management skills might include grounding, mindfulness, relaxation, paced breathing, or other strategies that you already know help regulate distress. Emotional flexibility is also important because recovery can involve excitement, hope, relief, anxiety, frustration, grief, vulnerability, and uncertainty, sometimes within the same day. Rather than judging yourself for having a particular reaction, try to make room for a full range of emotions that can accompany a major life event. You also need some tolerance for uncertainty. Healing takes time, and you may not know what your final surgical outcome looks like for weeks or even months. Temporary pain and physical discomfort are also part of many recoveries, so following your medical team's pain management plan while using psychological coping strategy can help make that period more manageable. It can also be helpful to identify accessible activities for periods when your mobility or energy is limited, such as books, music, movies, games, conversations, or other meaningful distractions. And finally, practice asking for help. Recovery is not a test of independence. Being able to clearly communicate what you need and accept appropriate support can make the recovery process safer and less stressful. Your coping plan doesn't need to be elaborate. The most useful strategies are the ones that you can realistically access and use when you're having a difficult day. Planning your support before surgery can make recovery significantly more manageable, and support involves more than simply knowing that people care about you. It means identifying who can realistically help and what they can help with, and how you will communicate what you need. Your medical team is one part of that network and may include your surgeon, nursing staff, primary care provider, hormone prescriber, and other specialists depending on your care. Practical support is also important because everyday tasks can become surprisingly difficult when you're tired, uncomfortable, or temporarily restricted in your movement. Consider who can help with transportation, meals, medications, household responsibilities, pets, errands, and getting to post-operative appointments. Emotional support may come from trusted friends, partners, family members, or other people who can listen, check in, and offer encouragement without making your recovery about their own reactions. A therapist or other mental health professional can also provide support before or after surgery, particularly if the emotional adjustment becomes more challenging than expected. Peer and community support can be valuable as well because people with lived experience may offer practical insight and reassurance, although it's important to remember that someone else's recovery won't necessarily predict your own. Before surgery, ask yourself a very practical question. If I'm having a difficult day during recovery, who can I realistically contact? Having specific names and specific types of help in mind can make it much easier to reach out when you're tired and overwhelmed. A strong support plan isn't necessarily about having a large number of people around you. It's about knowing who is available, what you can reasonably ask of them, and how to access that support when you need it. Preparing for recovery means recognizing that surgery is a process rather than a single event. In the early stages, your primary responsibilities may simply be resting, healing, and meeting basic needs. You may temporarily lose some independence and need help with everyday activities such as bathing, dressing, preparing food, caring for your home, and running errands. Your usual routines may also change significantly. Work, exercise, sleep, social activities, and sexual activity may all be limited for a period of time, so planning for those disruptions beforehand can make them easier to manage. Another psychological challenge can be seeing your body while it's still healing. Swelling, bruising, incisions, dressings, scars, and temporary asymmetry can make your appearance look very different from what you expected, especially early on. Try to remember that your body you see during early recovery is not the final surgical result. Emotionally, you may experience relief and happiness alongside anxiety, frustration, grief, vulnerability, or uncertainty, and those reactions can all occur during a normal recovery. As healing progresses, the focus gradually shifts towards rebuilding routines, strength, confidence, and independence. Your body and your mind may not recover at exactly the same pace, so patience matters. Finally, follow-up care is an essential part of recovery. Attending post-operative appointments and following instructions for wound care, medications, activity restrictions, dilation when applicable, and other procedure-specific aftercare can support healing and help identify complications early. Recovery often happens through small, gradual steps, and progress does not need to occur on a perfectly predictable timeline. As we finish this section on psychological preparation, one of the most important things you can do is keep the experience in perspective. Gender affirming surgery can be an incredibly meaningful milestone, but it is still one part of your larger life, identity, and personal journey. Healing also takes time, and physical recovery and psychological adjustment don't necessarily happen at the same pace. You might feel physically better before you feel emotionally settled, or you may feel immediate emotional relief while your body still requires weeks or months to heal. Mixed emotions are possible as well. Feeling anxious, frustrated, vulnerable, disappointed, or temporarily uncertain during recovery does not automatically mean that that decision was wrong. Try to avoid measuring your recovery against carefully selected photographs, social media posts, or someone else's timeline, because your anatomy, procedure, healing process, circumstances, and emotional experiences are your own. Your goals can evolve too. What felt most important before surgery may change afterward as you become familiar with your body and begin thinking about what comes next. And if distress, adjustment difficulties, relationship concerns, or unexpected outcomes become difficult to manage, seeking additional support from your medical team or a mental health professional is appropriate. The goal of psychological preparation isn't to guarantee that you'll have a perfect emotional response to surgery. It's to help you enter the experience informed, supported, psychologically flexible, and prepared to adapt to whatever your individual recovery brings. Now we're going to shift from preparing for surgery to what happens during physical recovery and aftercare. Recovery can look very different depending on the procedure, your individual health, how your body heals, and whether any complications occur. In the immediate post-operative period, the focus is usually on rest, pain management, monitoring swelling and bruising, and following the instructions provided by your surgical team. Wound care may involve keeping incisions clean, monitoring for signs of infection, and caring for drains, catheters, dressings, or other surgical sites when applicable. There may also be temporary restrictions on lifting, exercise, driving, work, sexual activity, and other daily activities, with those restrictions gradually changing as healing progresses. Follow-up appointments are an important part of this process because they allow your surgical team to monitor healing, address concerns, and identify potential complications. Longer-term aftercare can include scar care, dilation when applicable, rehabilitation, and other procedure-specific care. Some people may eventually choose or require revision or additional procedure, while others will not. Most importantly, healing is rarely a perfectly linear process. You may have days where you feel noticeably better, followed by days when you feel more tired or frustrated. That doesn't necessarily mean that recovery is moving backward. In this section, we'll look more closely at what physical healing can involve and how to support your body throughout the recovery process. The immediate post-operative period refers to the first hours and days after the surgery, and the primary goal during this time is not to bounce back quickly, it's to rest, stabilize, and give your body the opportunity to begin healing. Pain and discomfort are common after surgery, although the type, intensity, and duration can vary significantly depending on the procedure and the individual. Swelling and bruising are also common parts of the body's early healing response and may temporarily make the surgical area look very different from its eventual appearance. Fatigue can be substantial as well. Anesthesia, pain medication, disrupted sleep, reduced activity, and the amount of energy your body is using to heal can leave you much more tired than you expect. Depending on the procedure, you may temporarily have drains, surgical dressings, a catheter, or other medical devices that require specific care. Basic activities such as getting out of bed, walking, bathing, dressing, preparing food, or using the bathroom may also require assistance initially. This can feel frustrating, particularly if you're accustomed to being independent, but accepting appropriate help will allow your energy to remain focused on healing. Keep in mind that postoperative experiences vary considerably. Two people having the same procedure may experience different levels of pain, swelling, fatigue, mobility, and recovery time. During these first days, progress may simply mean resting, following your surgical team's instructions, meeting your basic needs, and following your body to do the work of healing. Wound care is one of the most important parts of protecting your surgical result and reducing the risk of complications during recovery. Because postoperative care can vary substantially depending on the procedure and surgical technique, your surgeon-specific instructions should always take priority over general information. This may include keeping incisions clean and appropriately protected, taking medications as prescribed, and following instructions for dressings, drains, and other postoperative devices. It's also important to avoid picking at incisions or scabs, applying products that haven't been approved by your surgical team, or returning to strenuous activity before you've been medically cleared to do so. Online communities can be useful sources of support and lived experience, but another person's postoperative instructions may not be appropriate for your procedure or your body. So changes to wound care should be discussed with your surgical team rather than based solely on online advice. You'll also want to monitor the surgical site for changes your team has told you to watch for, which may include increasing redness, unusual or increasing drainage, separation of the wound, or worsening swelling or pain. Some swelling, bruising, discomfort, and changes in appearance are expected during normal healing. So the goal isn't to become alarmed by every change. Instead, know what your surgical team considers expected, know what warning signs they want you to report, and contact them when something falls outside those expectations. Good wound care is ultimately about following the individualized plan you've been given and allowing the surgical site and the time the protection it needs to heal. Pain, swelling, bruising, and fatigue are all common parts of early surgical recovery, although their intensity and duration can vary significantly depending on the procedure and the individual. Pain may feel like soreness, tightness, pressure, tenderness, or occasionally sharper sensations, and it is often most noticeable during the first several days before gradually improving. Swelling is also an expected part of the body's healing response and can persist for several weeks, or with some procedures, considerably longer before final contours become apparent. Bruising may change color as it resolves and typically fades gradually as healing progresses. Fatigue is sometimes underestimated. Your body is directing substantial energy towards tissue repair, and anesthesia, medications, disrupted sleep, changes in activity, and emotional demands of recovery can all contribute to feeling unusually tired. You may also notice that your energy improves and then temporarily decreases again after increasing your activity, which doesn't necessarily mean that something is wrong. Follow the pain management and activity recommendations provided by your surgical team. Use ICER compression only when instructed. Prioritize adequate rest, stay hydrated, and support healing with appropriate nutrition. While many early symptoms are expected, contact your surgical team if pain, swelling, or other symptoms are worsening unexpectedly or differ from what they told you to anticipate. Recovery isn't a competition, and there is no benefit to forcing your body to heal faster than it is ready to. Improvement generally happens gradually, so give yourself permission to rest and allow your body the time it needs. Returning to normal activity after surgery is usually a gradual process rather than something that happens all at once. Early in recovery, rest is important because your body needs energy to begin healing. But depending on your procedure, your surgical team may also encourage short periods of appropriate movement to support circulation and reduce some of the risks associated with prolonged inactivity. As recovery progresses, you can gradually begin returning to basic self-care and household activities, followed later by exercise and more demanding activities once you've received appropriate medical clearance. Procedure-specific lifting restrictions are particularly important because feeling capable of lifting something doesn't necessarily mean the underlying tissues have healed enough to tolerate the strain. Driving may also be temporarily restricted because pain, limited mobility, fatigue, or certain medications can interfere with your ability to drive safely. Returning to work depends not only on the procedure you've had, but also the physical and cognitive demands of your job. Someone working from home at a computer may have a very different timeline from someone whose job requires prolonged standing, lifting, or significant physical activity. Exercise and sexual activity also require individualized guidance because different procedures involve different tissues and healing requirements. One of the most important things to remember is that feeling better does not necessarily mean that your body has finished healing. It's very common to experience a burst of energy and feel tempted to do much too quickly. Increasing activity gradually and following your surgical team's recommendations can help protect your recovery even when you're beginning to feel more like yourself. It's also important to recognize that there isn't one standardized recovery process for gender-affirming surgery. Aftercare varies substantially depending on the procedure you've had. Following chest or breast surgery, for example, recovery may involve compression garments, incision care, restrictions on arm movement or lifting, and eventually scar management. After vaginoplasty, aftercare can be more intensive and may include wound care, hygiene routines, and structured dilation schedule to maintain the depth and width of the vaginal canal as it heals. Vulvoplasty has different aftercare requirements because a full-depth vaginal canal is not created, so the long-term dilation needs are generally different. Recovery from phalloplasty or metoidoplasty may involve catheter care, monitoring urinary function, caring for surgical or donor sites, and returning for additional follow-up, particularly when the reconstruction occurs in multiple stages. Facial procedures can involve significant swelling and bruising, temporary dietary changes, specific sleeping or head positioning instructions, and restrictions on certain activities while the facial tissues and bones heal. Even within the same category of surgery, aftercare can differ based on the specific technique, surgeon, anatomy, and individual healing process. This is why someone else's recovery instruction should never automatically become your own. Your surgical team's procedure-specific guidance should remain the primary source for what you need to do, what you should avoid, and when you can safely progress through different stages of recovery. Most challenges that occur during recovery are temporary and part of normal healing, but it's important to know when something may require additional medical attention. Physical warning signs can include increasing redness, warmth, swelling, drainage, worsening pain, or fever, which may indicate an infection. Persistent bleeding, unusually large areas of bruising or swelling that contains worsen rather than gradually improving should also be reported to your surgical team. Symptoms such as chest pain, significant shortness of breath, a rapid heartbeat, or sudden pain or swelling in a leg can indicate potentially serious cardiovascular complication and require urgent medical evaluation. Pain that becomes severe, continues to worsen, or is not adequately controlled by the treatment plan you've been given should also be discussed with your medical team. Psychological complications deserve attention as well. A significant increase in gender dysphoria, persistent changes in mood, severe anxiety or panic, or body image distress that interferes with your daily functioning may indicate that additional mental health support would be helpful. Some symptoms require immediate medical attention, including uncontrolled bleeding, severe shortness of breath or chest pain, sudden severe leg pain or swelling, confusion, fainting, or loss of consciousness, or other symptoms your surgical team has identified as an emergency. The specific warning signs and thresholds can vary by procedure and individual medical circumstances, so follow the emergency instructions provided by your own surgical team. The purpose of knowing these warning signs isn't to make you fearful of recovery, it is to help you distinguish expected discomfort from situations where getting help promptly can prevent a more serious complication and support a safer recovery. One of the most important things to remember during recovery is that the result you see early on is not the result you'll likely see later. During the first couple weeks, swelling, bruising, tightness, tenderness, and sensitivity around incisions are common, and the surgical area may look quite different from what you expected. Over the following weeks, swelling generally begins to decrease, stitches may dissolve or be removed, and you may notice temporary unevenness or asymmetry as different areas heal at different times. Over the next several months, scars typically begin to soften and fade, sensation may continue to change, and the overall shape and contour of the surgical area can gradually become more refined. This process can continue for 6 months, 12 months, or even longer depending on the procedure, the location of the scars, your individual healing, and other medical factors. Scar maturation itself is a long process, so early redness, firmness, or visibility doesn't necessarily predict how a scar will ultimately look. Follow your surgeon's recommendations regarding scar care, which may include products or techniques such as silicone therapy, moisturizing, massage, or sun protection when appropriate for your specific procedure and stage of healing. Supporting your body through adequate nutrition, hydration, appropriate movement, and rest can also contribute to overall recovery. Psychologically, it can take time to adjust to seeing a changing body in the mirror, especially when you're evaluating something that is still actively healing. Try not to judge the final outcome from an early stage of recovery. Your body may continue changing long after the procedure itself is over, and allowing that process to unfold is an important part of both physical and emotional healing. Eventually, recovery begins to feel less like recovery and more like everyday life again. At this stage, aftercare shifts from managing the immediate effects of surgery towards maintaining your physical health, psychological well-being, relationships, and the life you're building beyond the procedure. Continue any routine medical follow-up recommended for you and remain attentive to changes in your health even after the primary recovery period has ended. Your mental health and emotional adjustment may continue as well. Check in with yourself periodically and seek support from a therapist, support group, trusted people, or other resources if you find that you're struggling with these changes in identity, body image, relationships, or expectations. Maintaining basic health habits such as adequate nutrition, physical activity, and sleep can support both physical and emotional well-being. Relationships may also change as you become more comfortable expressing yourself, communicating your needs, or establishing new boundaries. And as surgery and recovery begin taking up less space in your daily life, you may find yourself returning attention to goals, hobbies, work, school, relationships, and other parts of yourself that have little or nothing to do with gender-affirming care. For some people, this new normal includes greater self-acceptance, confidence, peace, or energy. For others, the change may be quieter, such as simply thinking less about a part of the body that once caused significant distress. There is no single way that life is supposed to feel afterwards. Recovery is not the end of your development. It is one part of an ongoing life in which your goals, relationships, identity, and sense of meaning can continue to evolve. Now that we've discussed physical recovery, I want to focus more specifically on something that can sometimes catch people by surprise: the emotional experience after surgery. Even when surgery is deeply wanted and the outcome is affirming, recovery can still involve significant fluctuations in mood. Hormonal changes, anesthesia, medications, pain, disrupted sleep, physical limitations, and stress of healing can all affect how you feel. You might experience periods of sadness or low mood, anxiety about whether you're healing correctly, irritability from fatigue or discomfort, or vulnerability related to temporarily depending on other people. At the same time, you may also experience relief, excitement, gratitude, hope, or a growing sense of connection with your body. These experiences aren't mutually exclusive. You can be happy that you had surgery and still have a difficult day. You can feel relief about your body while also feeling frustrated by recovery. You can even experience temporary uncertainty without that automatically meaning regret. Emotional recovery, like physical recovery, is rarely perfectly linear. There may be good days and difficult days, and your emotional state can change as swelling decreases, pain improves, or your independence returns, and you may become more familiar with your body. The important point is not to interpret every difficult emotion as evidence that something is wrong. Give yourself time to recover physically and psychologically. Lean on appropriate support when you need it, and remember that adjustment itself is part of the healing process. Let's look more closely at some of the mood changes that can occur during recovery. After surgery, your emotional regulation can be affected by several things happening at the same time, including pain, disrupted sleep, medications, reduced activity, physical dependence, and overall stress your body has experienced while it heals. Because of this, some people notice mood swings or find that their emotions feel more intense or less predictable than usual. Temporary sadness, low mood, emotional flatness, or even disappointment can also occur, including after a procedure that you genuinely wanted and still feel was the right decision. Anxiety is common as well, particularly when you're monitoring your body closely and wondering whether you're healing correctly, whether something might be a complication, what the final result will look like, or how sensation and function will develop over time. You may also experience emotions that seem contradictory. Relief and excitement can exist alongside sadness, worry, frustration, or vulnerability. One feeling doesn't invalidate another. This is particularly important because people sometimes interpret difficult post-operative emotions as evidence that they regret surgery, when those emotions may instead reflect the temporary physical and psychological demands of recovery. Rather than expecting yourself to feel consistently happy because surgery is complete, allow your emotional experience to be more complex. Pay attention to how you're doing, use your coping strategies and support system you've prepared, and give both your body and your emotions time to stabilize as recovery progresses. Fatigue deserves particular attention during recovery because healing requires a significant amount of physical and psychological energy. Even if you're spending much of the day resting, your body is still working continuously to repair tissue and recover from surgery. Sleep may also be disrupted by discomfort, positioning requirements, medications, or changes in your normal routine, and reduced activity can sometimes leave you feeling both tired and restless at the same time. Physical fatigue can also become mental fatigue. You may notice that it's harder to concentrate, make decisions, tolerate frustration, or regulate your emotions as effectively as you normally would. This can contribute to irritability. Pain and discomfort can reduce your emotional bandwidth. Needing help from other people can become frustrating, and activity restrictions may leave you feeling confined or impatient. As a result, relatively minor inconveniences or stressors may temporarily feel much more difficult than they ordinarily would. If you notice yourself becoming more irritable, it can be helpful to ask whether you're actually emotionally upset about the situation, or whether you're exhausted, uncomfortable, overstimulated, or simply reaching the limits of your available energy. Recovery may require you to temporarily function at a different pace than you're accustomed to. Giving yourself permission to rest, reduce unnecessary demands, and conserve your energy isn't a failure to cope. It's part of allowing your body and nervous system the resources they need to heal. Another emotional adjustment that can occur during recovery is feeling more vulnerable than you're accustomed to. After surgery, you may temporarily need help with transportation, meals, medications, household responsibilities, personal hygiene, wound care, or other tasks that you normally manage independently. For someone who strongly value self-sufficiency, that change can feel frustrating, uncomfortable, or even embarrassing. Your usual rules and routines may also be disrupted, and it can be difficult to temporarily shift from being the person who helps others to being the person who needs help. There can also be a deeper emotional vulnerability associated with recovering from a major change to your body. You may feel physically exposed, uncertain about healing, more sensitive to comments from other people, or simply more emotional than usual. None of this means that you've lost your autonomy. Needing support during recovery and having control over your own life are not opposites. In fact, clearly communicating what you need, deciding who you want involved, and establishing boundaries around how people support you are always maintaining autonomy during a period of temporary dependence. Try to be specific when asking for help. Instead of expecting someone to know what you need, tell them whether you need a meal, a ride, help with the tasks, someone to listen, or simply some quiet time, some quiet company. Accepting appropriate support allows more of your physical and emotional energy to remain focused on healing. Recovery is temporary, and leaning on other people for a period of time does not diminish your independence. It can simply be a part of taking care of yourself while your body heals. One of the most helpful things to remember during recovery is that healing is not linear. You may have a good day when you feel stronger, more hopeful, and more like yourself, followed by a difficult day where pain, fatigue, swelling, anxiety, or frustration suddenly feels more noticeable again. Then you may have another day when you recognize small improvements, followed by what you feels like might be a setback. That pattern can be discouraging if you're expecting recovery to move steadily forward every day, but fluctuations don't necessarily mean that something is wrong or that you've lost progress. Physical healing and emotional adjustment both tend to occur unevenly. Changes in activity, sleep, pain, swelling, medication, stress, and even how closely you're paying attention to your body can affect how you experience a particular day. Instead of evaluating your recovery based on a single difficult day, try to look at the broader pattern over time. You may be able to walk a little further, need less assistance, experience less pain, have more energy, or spend longer periods of time thinking about things other than recovery. Those small changes are still progress. Early post-operative distress is also occurring during a demanding but temporary phase of healing, and difficult emotions often become more manageable as your body recovers and everyday routines begin returning. If distress becomes overwhelming, persists, or begins interfering significantly with your recovery or daily functioning, reach out to your medical or mental health provider for additional support. A difficult day does not define your recovery, and progress can still be occurring even when it isn't immediately obvious. This brings us to a broader discussion about expectations versus reality. Gender affirming surgery can create meaningful changes, but understanding what it can and cannot change is important for long term psychological adjustment. Surgery may substantially reduce gender dysphoria, increase a sense of congruence with your body, reduce gender related distress, support greater self acceptance and authenticity, and improve quality of life for many people. At the same time, surgery doesn't automatically resolve every difficulty in someone's life. Depression, anxiety, trauma, ADHD, relationship problems, financial stress, loneliness, work responsibilities, and other life challenges may still be present afterward and may continue to require their own forms of treatment, coping, or support. This distinction matters because it's possible to experience a very positive surgical outcome while still having difficult emotions or problems in other areas of life. It's also possible for the surgical result itself to differ somewhat from what you imagined. If reality doesn't perfectly match your expectation, feeling disappointed, confused, frustrated, or even grieving aspects of the outcome doesn't automatically mean that surgery was a mistake. It means that you're adjusting to a real body and real outcome rather than the version you had imagined beforehand. Realistic expectations aren't about lowering your hopes. They're about understanding which changes surgery can reasonably support, recognizing which parts of life will still require attention afterwards, and giving yourself room to adapt when the actual experience is more complicated than the one you pictured. Another important part of adjustment after surgery involves body image, sexuality, and intimacy. Physical healing may happen over a period of weeks or months, but developing familiarity with your changed body can be a different process entirely. You may need time to learn how your body looks, feels, responds to touch, and functions in ways that are different from what you were accustomed to before surgery. Sensation, arousal, comfort, and sexual functioning can continue to evolve as nerves and tissues heal, and your psychological relationship with your body may continue changing alongside that physical recovery. Body image can fluctuate during this process as well. You may feel more comfortable and confident on some days while still feeling unfamiliar, self-conscious, or uncertain on others. Intimacy with a partner can introduce another layer of adjustment, making communication about comfort, boundaries, fears, desires, and changing sensations especially important. Sexual confidence may need to be rebuilt gradually as you discover what feels pleasurable, comfortable, affirming, or simply different. This exploration doesn't need to follow anyone else's timeline, and intimacy doesn't need to immediately return to what it looked like before surgery. Vulnerability, trust, and a new sense of bodily familiarity can develop gradually through safety, communication, curiosity, and mutual respect. Ultimately, the goal isn't simply to become accustomed to a surgical result. It's to develop an increasingly integrated relationship with your body, your sexuality, your sense of self, and the forms of intimacy and connection that are meaningful to you. After surgery, even changes that you deeply wanted can initially feel unfamiliar. You may have spent years imagining a particular change to your body, but imagining it and actually living in that changed body are two different experiences. Familiarity develops through repeated everyday experiences, getting dressed, showering, moving, looking in the mirror, touching different areas of your body, or simply noticing how your body occupies space may all feel different at first. Some of those differences may feel immediately affirming, while others may take more time to become ordinary. It's also important to recognize that physical healing and psychological familiarity don't necessarily occur at the same pace. A surgical site may be medically healing while your brain is still adjusting to a new visual appearance, new sensations, or different internal map of your body. Conversely, you may feel psychologically connected to the change very quickly while your body is still physically recovering. Feeling unfamiliar with your body during this adjustment period does not necessarily mean that something went wrong or that the change was unwanted. Your brain has spent years learning what your body looked and felt like before surgery, and updating that sense of bodily familiarity can take time. Gradually, experiences that initially require conscious attention can begin to feel increasingly ordinary and integrated. The goal isn't to force yourself to immediately feel completely at home in your changed body, it's to give yourself enough time and experience for familiarity to develop naturally. Sensation is another area where adjustment can continue well beyond the initial healing period. After surgery, you may experience numbness, hypersensitivity, tingling, altered sensation, or areas that simply feel different from what you remember before the procedure. This happens because nerves and surrounding tissue are healing, and sensory recovery can occur gradually over many months. Touch, therefore, feel unfamiliar at first. Something that once felt pleasurable may temporarily feel neutral, uncomfortable, or overly sensitive, while areas that initially feel numb may gradually develop more sensation as healing progresses. Sexual arousal and functioning can also feel different after surgery, and depending on the procedure, you may need time to learn how your changed anatomy responds to stimulation and what feels now comfortable or pleasurable. It's important not to assume that your sensory experiences during the early postoperative period represent your permanent outcome. Once your surgical team has medically cleared you for sexual activity or exploration, approaching your body gradually and with curiosity can help you become familiar with these changes without placing pressure on yourself to respond in a particular way. You may need to experiment with different types of touch, pressure, positioning, pacing, or stimulation as you learn what works for your body now. Specific sensory and sensual outcomes vary substantially depending on the procedure, surgical technique, individual anatomy, nerve healing, and other medical factors. Give your body time to heal and give yourself permission to learn rather than expecting yourself to immediately know how your changed body is supposed to feel. As your body continues to heal, your body image and self-perception may continue changing as well. Even when the physical changes are affirming, it can take time for your internal image of yourself to catch up with what you see and experience. You may have days when you feel confident and connected to your body, and other days when you focus more closely on scars, asymmetry, healing, or aspects of your appearance that still feel unfamiliar. Self-compassion can be especially important during this period. Rather than evaluating your body only by how it looks, it can be helpful to notice what your body allows you to do, how it feels to live in, and whether you're experiencing greater comfort or congruence over time. If you have a partner or partners, these changes can also affect intimacy and the relationship itself. Open communication can reduce the pressure for either person to guess what the other is experiencing. Talk about what feels comfortable, what feels different, what you're nervous about, what feels pleasurable, and what you need emotionally or physically. Partners also need space to listen, ask respectful questions, and adapt to changes without assuming that intimacy should immediately return to exactly what it looked like before surgery. Boundaries may change during recovery, and your comfort with particular forms of touch or sexual activity may evolve as sensation and confidence develop. Rebuilding intimacy can therefore be something you explore together rather than something either person is expected to already understand. Patience, honesty, empathy, and clear communication can help create the safety needed for both body image and intimate connection to continue developing. As you become more familiar with your changed body, sexual confidence may also begin to develop in new ways. What feels pleasurable, comfortable, exciting, or affirming may be different from what you experienced before surgery, and rediscovering those things can take time. There is no need to rush this process or to prove that your body functions in a particular way. Once you've been medically cleared for sexual activity, curiosity and gradual exploration can help you learn your new comfort zones, preferences, sensations, and boundaries. Communicating openly with a partner or partners can make that exploration feel safer, particularly when you're able to talk about what feels good, what feels sensitive, and what you're uncertain about, and what you would like to try or avoid. Intimacy can involve significant vulnerability. Allowing someone to see or touch a part of your body that has changed may feel emotionally different than you expected, even when you trust that person. You may feel excited and self-conscious at the same time, or want closeness while also needing reassurance, patience, and more control over the pace of physical contact. Trust often develops through small, consistent experiences of having your boundaries respected and your vulnerability treated with care. You don't have to disclose, explore, or engage in intimacy faster than feels comfortable simply because your physical recovery has progressed. Sexual confidence isn't about reaching a particular level of performance or comfort. It's about developing a sexual relationship with your body that feels increasingly safe, authentic, pleasurable, and your own. Your pace is valid, and intimacy can grow gradually as familiarity, confidence, and trust continue to develop. As this process continues, your changed body can gradually begin to feel less like something you're consciously adjusting to and more simply like your body. That sense of familiarity familiarity develops through time and ordinary experience. You may begin noticing new sensations, new areas of comfort, changes in movement, or ways of interacting with your body that increasingly feel natural. Try to approach that process with curiosity rather than pressure. Notice what feels good, what feels neutral, what still feels unfamiliar, and what changes as healing continues. It's also helpful to focus on growth rather than perfection. Your relationship with your body doesn't have to depend on achieving a flawless surgical result or feeling completely confident every day. Small amounts of comfort, increased ease with touch, greater confidence looking in the mirror, or simply spending less time thinking about your body can all represent meaningful progress. Self-compassion is particularly important during this adjustment. On difficult days, try to speak to yourself with some patience that you would offer to someone else who was recovering from a major medical procedure and adapting to significant change. Give yourself permission to rest, take breaks, establish boundaries, and move at your own pace. Healing isn't linear, and neither is learning to trust and inhabit your body differently. Over time, repeated experiences of movement, sensation, touch, intimacy, and everyday life can help your internal sense of body become increasingly integrated with the physical changes you've experienced. There's no deadline for reaching that point. Familiarity, confidence, and self-compassion are things that can continue developing long after physical recovery itself is complete. As your relationship with your body and identity continue to evolve, your relationships with other people may evolve as well. Gender-affirming care can affect partnerships, family relationships, friendships, workplace interactions, and the way you choose to navigate disclosure in different areas of your life. Partners may need time to adjust alongside you, particularly when physical changes, sexuality, intimacy, or relationship roles begin to feel different. Open communication, patience, empathy, and clear boundaries can help both people navigate those changes without assuming that adjustment will happen at exactly the same pace. Family responses can vary considerably. Some family members may be strongly supportive, while others may need time, education, or boundaries around what kinds of questions and behaviors are acceptable. Friendships can change as well. Some may become stronger as you feel increasingly comfortable being yourself, while others may become more distant or reveal limitations that were less visible before. In workplaces and other social environments, decisions about disclosures, names, pronouns, and how much personal information you share remain yours to make based on your comfort, circumstances, and safety. You may also encounter people who misunderstand your experience, ask intrusive questions, or expect you to educate them. You are allowed to decide which conversations you want to participate in and which boundaries you need to establish. Relationships aren't static, and transition can make some changes more visible. There may be relationships you grieve, relationships that deepen, and entirely new connections that become possible. The goal isn't to preserve every relationship exactly as it was. It's to build and maintain relationships in which you can experience respect, authenticity, connection, and support. Partnerships and intimate relationships may need time to adjust alongside you, even when the changes taking place are positive and wanted. Transition and gender-affirming care can affect how both people experience affection, intimacy, sexuality, attraction, roles, communication, and expectations within the relationship. This doesn't automatically mean that something is wrong with the relationship. It means that both partners may be adapting to change. Rather than assuming that your partner knows what you need or assuming that the relationship shouldn't continue functioning exactly as it did before, talk openly about what is changing. That might include how you want to be touched, what kinds of affection feel affirming, changes in sexual comfort or desire, new boundaries, changes in body confidence, or shifts in how each person understands their role in the relationship. It's also important to make room for mixed emotions on both sides. Excitement, relief, uncertainty, vulnerability, and even grief about certain aspects of change can sometimes coexist without invalidating the relationship or the transition itself. Try to remain curious about each other rather than relying entirely on what used to work. Ask what your partner needs now, communicate what you need now, and recognize that those answers may continue evolving. Healthy relationships aren't defined by remaining unchanged. They are often defined by the ability to adapt while preserving respect, trust, emotional safety, and connection. Change does not automatically mean disconnection. And with open communication, patience, and empathy, relationships can develop new ways of feeling close as both people adjust. Family relationships can be another important area of adjustment, and different family members may respond in very different ways and on very different timelines. Some relatives may adapt quickly and others immediate affirmation, while others may need considerably more time to understand the changes occurring in your life. Support can also take different forms. One person may be emotionally expressive and verbally affirming, while another may demonstrate support through practical help, change behavior, or simply making a consistent effort to learn. At the same time, it's important to recognize that you cannot do another person's emotional work for them. Providing information or answering reasonable questions may help, but you are not responsible for resolving every family member's discomfort, uncertainty, grief, or misunderstanding. You also don't have to repeatedly participate in conversations that leave you feeling invalidated, exhausted, or pressured to defend your identity or healthcare decisions. Protecting your emotional energy may mean deciding when a conversation is productive, when it needs to be redirected, and when you need to disengage entirely. Boundaries aren't necessarily a rejection of your family. They can be a way of preserving relationships while also protecting your psychological well-being. You can care deeply about someone and still decide that certain comments, questions, or behaviors are not acceptable. Ultimately, your family members are responsible for their own process of adjustment, while you are responsible for your own care, boundaries, and well-being. Their pace of adjustment is not a measure of the legitimacy of your identity, the value of your decisions, or your worth as a person. Friendships can also change as you move through transition and become more comfortable living authentically. Some friendships may actually deepen because you're able to show more of yourself, communicate more openly, and experience a greater sense of emotional closeness. Other relationships may shift or become more distant, and that doesn't necessarily mean that either person failed. Sometimes people grow in different directions, and transition can make differences in values, understanding, or compatibility more visible. One useful thing to pay attention to is how you consistently feel around particular people. Do you feel respected and able to relax, or do you feel guarded and constantly aware of how you're being perceived? Do interactions generally leave you feeling connected and energized, or depleted from explaining, defending, or minimizing yourself? Those patterns can provide useful information about which relationships are supporting your well-being. Building an affirming social circle doesn't mean that everyone around you needs to share your identity or have identical experiences. It means developing relationships where basic respect doesn't have to be continually negotiated and where you have room to be a whole person rather than feeling defined only by your gender transition. This may involve strengthening existing friendships, becoming involved in new communities, or gradually allowing some relationships to occupy less space in your life. There can be grief when relationships change, even when that change is ultimately healthy. The goal isn't to keep every relationship exactly the way it was, it's to invest in connections where you can experience mutual respect, authenticity, support, enjoyment, and genuine sense of belonging. Workplaces and everyday social situations can bring their own set of decisions about how much of your identity transition or medical care you want to discuss with other people. There isn't one correct level of disclosure. You get to decide what feels comfortable based on the situation, the relationship, and your own needs. It can be helpful to think ahead about how you want to handle things like names, pronouns, personal questions, or conversations about your transition, because having a few brief responses prepared can reduce the emotional and cognitive burden of having to decide what to say in the moment. That might be as simple as saying, I go by this name and use these pronouns, or I prefer not to discuss that. You also don't have to provide detailed explanations simply because someone asks a question. Correcting someone is your choice as well. There may be times when you want to correct a name or pronoun immediately, times when you decide to let something go, and situations where you'd rather ask a trusted colleague, supervisor, or another person to help address an ongoing issue. In workplace settings, available support may include trusted coworkers, supervisors, human resources, or formal workplace accommodations when appropriate. The goal isn't to manage every social interaction perfectly or to educate everyone you encounter. Continually deciding when to explain, correct, disclose, or disengage can itself require emotional energy, so it's reasonable to choose responses that protect that energy. You deserve to be treated with dignity and respect in professional and everyday environments, and you are allowed to establish boundaries around which parts of your personal experience you choose to share. Another part of social adjustment involves deciding what you want other people to know about your gender transition, medical care, or personal history. Disclosure is a choice, and different situations may call for different levels of openness. You may feel comfortable sharing certain information with a close friend or partner while choosing to keep that same information private from coworkers, acquaintances, or people you've just met. Privacy is not dishonesty. Choosing not to discuss personal medical information or aspects of your history does not make you deceptive or inauthentic. Before sharing something personal, it can be helpful to consider whether the person has demonstrated that they can handle sensitive information respectfully and whether sharing actually serves a purpose that matters to you. Boundaries can also be communicated very simply. You might say, that's personal and I'd rather not discuss it. I'm comfortable answering some questions, but not that one. Or I'll bring it up if I want to talk about it. You don't need to provide a lengthy explanation for why a boundary exists, and your boundaries are allowed to change. Something you feel comfortable discussing today may feel more private later, while something you initially kept private may become easier to share as circumstances or relationships change. The important point is that access to your personal history is not something other people are automatically entitled to. You get to decide what you want to share, when you share it, why you share it, and with whom. Maintaining privacy and setting boundaries can be important ways of protecting your emotional energy, autonomy, and overall well-being. As we finish this section on relationships and social adjustment, it's important to recognize that living more authentically doesn't guarantee that everyone around you will understand your experience. You may encounter curiosity, assumptions, intrusive questions, misgendering, or people whose expectations about gender don't align with your own experience. When that happens, try to separate another person's reaction from the legitimacy of your identity. Someone else's confusion, discomfort, or lack of understanding does not determine who you are or whether your experience is valid. You also get to choose where you invest your emotional energy. Not every misunderstanding requires an explanation, not every question deserves an answer, and not every disagreement needs to become a debate. Instead, consider investing more intentionally in relationships characterized by respect, reciprocity, empathy, curiosity, and genuine acceptance. Finding your people doesn't necessarily mean surrounding yourself only with people who share your identity. It means developing connections where you can be known as a whole person and where acceptance isn't conditional on making yourself smaller or more comfortable with someone else. There may also be grief involved in recognizing that certain relationships no longer fit in your life in the same way, and there can simultaneously be joy discovering relationships that become stronger or finding entirely new communities where you feel a greater sense of belonging. Social adjustment isn't about successfully getting everyone to understand or approve you. It's about building a life in which you have meaningful opportunities to be known, respected, supported, and connected while continuing to grow into the person you want to be. As recovery progresses, the focus gradually shifts away from surgery itself and back towards everyday life. Returning to work, exercise routines, relationships, and other responsibilities doesn't need to happen all at once, and your timeline may look different from what you originally expected. When returning to work or other productive activities, consider your energy level as well as your physical recovery and communicate your needs or take breaks when necessary. Exercise and movement can gradually return according to your medical team's guidance, with the goal of rebuilding strength and activity without pushing your body faster than it is ready to go. Daily routines such as sleep, nutrition, medications, hygiene, household responsibilities, and other forms of self-care may also need to be rebuilt gradually. Social activities can return at your own pace as well, and spending time with people who support and affirm you can make that transition easier. Dating, sexuality, and intimacy may require additional time as you continue developing comfort and confidence with your body, and you're allowed to establish boundaries based on what feels right for you now. Continue attending any recommended medical appointments, laboratory monitoring, or other ongoing care, and when you're feeling significantly better, even when you're feeling significantly better. And as recovery begins occupying less of your attention, this can also be an opportunity to reconnect with goals and sources of meaning that extend beyond transition or surgery. Your work, relationships, interests, values, passions, and future plans can begin moving back towards the center of your life. Returning to everyday life isn't about getting back to exactly who you were before surgery. It's about gradually building a routine and a life that fit who you are now. As we move beyond the immediate adjustment period, it's also important to look at what research tells us about the long-term mental health and quality of life following gender-affirming care. Overall, the evidence generally points towards meaningful improvements for many people, particularly when individuals have access to appropriate medical care, social affirmation, and supportive environments. Studies commonly find reductions in gender dysphoria and gender-related distress following gender-affirming treatment, along with improvements in body satisfaction and self-esteem. Depression and anxiety symptoms may also decrease over time for many individuals, and research has found associations between access to gender-affirming care and lower levels of suicidal ideation and self-harm. Improvements can extend beyond mental health symptoms themselves. Many people report better social and daily functioning, greater comfort participating in work or education, and improvements in overall quality of life and life satisfaction. At the same time, it's important to describe this evidence accurately and recognize its limitations. Much of the available research is observational rather than based on randomized controlled trials. Many studies rely on self-report, follow-up periods vary, and additional long-term research across diverse populations is still needed. Outcomes also aren't determined by medical treatment alone. Social support, discrimination, financial stability, access to healthcare, relationships, pre-existing mental health concerns, and many other factors can influence someone's well-being over time. So gender-affirming care shouldn't be viewed as a guarantee that every psychological difficulty will disappear. Instead, the broader evidence suggests that appropriately selected and supported gender-affirming care can contribute to meaningful improvements in dysphoria, psychological well-being, functioning, and quality of life for many people. Before we conclude, it's important to discuss regret, detransition, and complicated outcomes because these experiences are real and deserve to be discussed accurately without judgment. These terms are sometimes used interchangeably, but they describe different experiences. Surgical regret generally refers to someone who has undergone a particular surgery and later wishes they had not had that procedure. Discontinuing treatment simply means stopping or pausing some aspect of medical transition, such as hormone therapy, and that decision may be temporary or permanent and does not necessarily mean the person regrets transitioning. Detransition generally refers to stopping or reversing some aspect of social, medical, or legal transition. Retransition refers to someone later resuming aspects of transition after having previously detransitioned. Research generally suggests that regret following gender-affirming surgery is uncommon, although estimates have important limitations because studies use different definitions, methods, follow-up periods, and populations, and some experiences may be underreported or lost to follow-up. The reasons people report regret or detransitioning are also diverse. They can include changes in how someone understands their identity or goals, dissatisfaction with a particular outcome, medical complications, unmet expectations, family or relationship pressure, discrimination, safety concerns, financial difficulties, loss of social support, or mental health concerns that require additional attention. These experiences should not be reduced to a single explanation, and they also shouldn't be used to invalidate people whose gender-affirming care has been beneficial. Someone who detransitioned deserves the same respect, compassion, and access to appropriate care as someone who continues transitioning. The goal of discussing these possibilities isn't to determine who should or shouldn't transition. It's to support informed decision-making, acknowledge that outcomes can be complex, and make room for people's experiences to evolve without turning those experiences into judgments about their worth or identity. As we've seen throughout this video, adjustment doesn't always end when physical recovery is complete, and there may be times when additional mental health support is helpful. You don't need to wait until something becomes a crisis to talk with a therapist or another mental health professional. Support may be useful if depression, anxiety, panic, hopelessness, or feeling overwhelmed begins interfering with everyday life, or if you're having difficulty adjusting to physical changes, recovery, or the pace of your transition. You may also want support if you're struggling with body image, changes in sexuality or intimacy, conflict or distance in important relationships, grief about things you've lost or left behind, or loneliness and isolation. Therapy can also provide a place to explore uncertainty about your identity, complicated feelings about transition, regret, or an outcome that didn't match what you expected. None of those experiences require you to arrive at a particular conclusion about yourself. They can simply be explored openly without judgment, and sometimes there isn't one specific problem at all. Gender-affirming treatment and surgery can represent a major life transition, and having a place to process that change can be useful even when things are generally going well. Effective mental health support should help you understand your experience, strengthen coping skills, navigate relationships, clarify what matters to you, and make informed decisions based on your needs and values. The goal isn't to tell you how you're supposed to feel about your transition. It's to help you navigate whatever you're actually experiencing and continue building a life that feels authentic, sustainable, and meaningful to you. As we come to the end of this video and of this three-part series, I want to bring everything back to the larger picture. In part one, we focused on understanding gender dysphoria, including what it is not, how it is diagnosed, and what the lived experience can actually look like. In part two, we focused on the mental health evaluation, including why evaluations are sometimes required, what happens during the process, how readiness and support are considered, and why informed consent and collaborative care matter. And here in part 3, we followed the journey into treatment, recovery, psychological adjustment, relationships, body image, sexuality, everyday life, and longer term mental health and quality of life. If there's one thing I hope you take away from the entire series, it's that gender affirming care is not one decision, one procedure, or one predetermined pathway. It's an individualized process that should be guided by accurate information, realistic expectations, informed choice, appropriate medical and mental health support, and respect for each person's goals and circumstances. For some people, that journey may involve hormones or surgery. For others, it may involve different forms of social transition, some combination of these options, or no medical intervention at all. There is no single endpoint that determines whether someone's experience is legitimate or successful. Wherever you are in this process, whether you're just beginning to explore, preparing for treatment, supporting someone you care about, or adjusting to life after treatment, I hope this series has helped make the process a little clearer and given you useful information for the decisions ahead. Thank you for spending time with me, and remember that understanding the mind can begin with just one insight at a time.